Good morning, doctor.
Yeah, how can I help you today, Robert?
Well, doctor, I've got some pain in my lower back, and there's a specific spot, there's just between my spine and my hips. Um, well, I just don't know what it is.
Oh, could you please explain about a bit more about the pain when it's started and about the
Yeah, it's like it's like a dull pain, and it is always there. But when I sit up, it is worse.
oh
So,
yeah.
um, and then, yeah, it is in my lower back, and
Mm.
uh,
Yeah, can I see the location?
yes, sure,
Okay,
and
okay.
and okay.
Yeah, yeah. Okay. May I ask you about any changes in your routine and your exercise
Uh,
habit? And
Yes, and yeah, now I've been training harder recently because I have a very important rowing competition,
oh,
and
routine.
yes,
Yeah.
yes, and so I do a lot of rowing and I do a lot of sit-ups, and I've been doing that 6 weeks, but this pain started about 2 weeks ago.
Okay. This pain started after you started the training, yeah?
That's right, yes,
Yeah.
yeah.
What do you think about the cause of this pain? Are you feeling it's because of this training, exercise, hard exercise?
Well, maybe, but yeah, I'm not sure. Maybe, but
Mm.
okay. But doctor, this is very important. This
Yeah,
it's a rowing competition.
yeah, I can
Um,
understand you. It's
yeah.
very important
So,
for you, yeah?
so you mean this might be because of too much strain? But But I don't have any choice, doctor. I have to do this. This is an opportunity of a lifetime. So what should I do? Do you think?
You know, for me, your health is very important.
Right?
So I strongly recommend you to reduce your exercise at this time because it will be hard
But
in the
I
future.
can't. I can't, doctor. It's I can't. Is there anything else I could do?
Beside that, I will refer you to a physiotherapist, and the physiotherapist can give advice you.
But I don't have time, doctor. I have to practice. I have to exercise.
I
Uh,
can understand you, but your health is very important. If you are not feeling well, you will not be able to join that competition.
right.
Y-
Okay.
Yeah, you need to see a physiotherapist, and he or she will make a training plan for you with
Right. Okay.
yeah. I think that will be very useful for you. And
So will I miss my competition? Do you think?
I cannot tell you right now, but yeah, after seeing the physiotherapist, then we will decide about that. So if the symptoms still remain, it's for more than 1 month, then we need to further investigation about your back pain.
Right. Okay. Okay. And
Yeah.
right. So okay. So does this mean that I can still go for my competition?
Now I'm referring you to a physiotherapist. You need to see them. You need to see the physiotherapist, and then based on the advice of physiotherapist, and then we will decide. Is that
I
okay? Is
see.
that with
Okay.
you?
Okay.
Okay.
Okay. All right. Thank you, doctor. Uh,
If you have, is there any question?
no, that's it. Thank you, doctor.
Okay. Okay.
Right.
You're
Okay.
welcome. See you.
See you later. Okay. Right. So how does that feel?
I think this time a bit better.
Okay, good. So feeling better.
Mm-hmm.
And what score out of 10?
7,
7.
after my understanding, maybe 7.
Okay, good. So what was done well?
Uh, Communication, engagement.
Okay, so your engagement was good. Okay, that is your rapport.
Yeah,
Yeah,
active.
your structure was
Mhm.
good. You found out the ideas, the concerns, expectations. So
Yeah,
what was the idea?
the idea was participation in the rowing competition.
Okay, so we need to use a sentence or a phrase. So what is the patient thinking when they come here? They say that, okay, there is something wrong with my back, but I don't know what it is. Okay.
Mm-hmm.
Concern. Oh, well, my concern is that I might miss my competition. So that is the concern. That is
Yeah,
the anxiety. Expectations to do something about it.
yeah.
Okay, right. Um, in your information gathering, you asked some questions, but we will discuss that. And in information giving,
Mm-hmm.
you also gave some information. Uh, what could be done differently? You said, what is the 3 marks you lose? What should we do differently to get 10?
Uh, uh, Maybe I missed some parts. I missed some parts, and maybe I was thinking that I give a 7 out of 10 because maybe my information gathering was not comprehensive, and also the structure. Maybe I will. I still I have some problem in the
Uh,
structure.
well, it was just your feeling, yes, but you didn't actually analyze. So, how many questions did you ask in information gathering? Do you remember?
2, 3, I think.
You said, could you tell me more? Okay,
Yeah. Mhm.
okay. And then, did you ask any other questions?
Oh, no, no.
Okay, so you didn't ask how long have you had it? Okay, I later
No,
because you didn't ask
but,
me.
but you have mentioned that 2 weeks ago it started. I have 6 week trainings, and the last 2 weeks it started.
Yes, that's because you didn't ask me. That's okay. But you just said, have you changed your routine? Okay.
Yeah.
Have you changed your routine? Okay. Okay. And that's why I said, yes, I've been training for 6 weeks.
Yeah.
But you didn't actually ask me how long have you had this pain? Then I said it
Mm.
myself. Okay.
Yeah.
Uh, okay. And then what else could you ask? Red flags. Right. For back pain, we have some red flags. Did you have any kind of any loss of power in your legs? Have you experienced any difficulties with your waterworks or with your bowels? Okay.
Mm.
Any signs of incontinence or any saddle numbness, any numbness between your legs where you sit on a saddle. Those are the signs of cauda equina syndrome. So you need to ask them. So any patient with these needs treatment within 12 hours. So that's an emergency. or they will have permanent damage to nerve. So, and this is something we need to explain to all patients with back pain, to say that if anything happens like this, you need to seek medical attention ASAP. Otherwise, there is no emergency. You just need to give it time. Okay.
Okay.
Right. So, yeah, it's definitely for if you have such a question in PLAB, you have to do this. But for this exam, well, this you don't have to, but it's good practice. Okay, so yeah, your structure was okay. I think you did well with the structure. You explained that your role is here to give them to give the patient the best advice possible, to make sure there is no harm done to them. Okay.
Okay. Yeah.
Uh, yeah, something you could use a couple of things, a couple of expressions. So
Mm-hmm.
basically, when the patient says, "Am I going to miss my competition?" So you can say it is unlikely. Okay.
Unlikely.
Yeah. So you can
Okay.
use this word likely, unlikely. It is very unlikely, or it is not likely that you miss your competition. We can't say now, but it's very unlikely. You have enough time. The patient says, "Well, I don't have time for physio, or I cannot reduce my exercise." You say it's just temporary, okay?
Mm-hmm.
So you can say it's just a temporary reduction, and then more staged or more gradual increase. Okay. So basically, the physio would be able to help you increase your exercise level more gradually, and to make sure that you're not harming your body. Because if when you have pain is a warning sign. Okay. It
Mm-hmm.
means there is something not right. So when there's something wrong, you need to address that. Okay.
Yeah. Yeah.
Yeah, well done. I think you did it quite well. I think, yeah, 7 or 8 even.
Oh.
Um,
Mm.
yeah, only this bit. You could ask more questions, but
Yeah.
you handled the conversation professionally, and you handled well. Okay.
Uh, thank
Uh,
you.
Good.